All right, let's get right into it. We're talking about endometriosis today, a condition that affects something like 1 in 10 women of reproductive age. But here's the thing. For anyone trying to start a family, it creates this incredibly cruel paradox. The disease itself can impact your fertility, and, get this, so can the very treatments designed to help. It's truly one of the most difficult balancing acts in reproductive health. This image here really breaks down just how endometriosis launches this multi-front attack on fertility. It isn't just one single problem. You can see how tissue that's supposed to be inside the uterus starts growing on the outside, creating these painful cysts called endometriomas. Now, these can literally create physical roadblocks, but the damage goes way deeper. Endometriosis creates this toxic, inflammatory environment that's just not friendly to sperm or embryos. And this is the real kicker for our conversation, it directly goes after a woman's egg supply. We call that the ovarian reserve. So let's just lock in on that term for a second. Ovarian reserve. Honestly, the best way to think about it is like a reproductive bank account. It's the total number and the quality of the eggs you have left. And one of the main ways we measure this is with a hormone called AMH. As we go through this, you're going to see why protecting this reserve, that bank account, is really the name of the game. So here's our game plan. First, we're going to dig into how the disease itself causes problems. Then, we'll walk that surgical tightrope where the cure can sometimes cause its own harm. After that, we'll get into the good stuff, how you can proactively preserve your options. And finally, we'll take a look at what's on the horizon, from cool new tech to the very real challenges of actually accessing it. Okay, first up, the disease itself. See, long before a surgeon even enters the picture, endometriosis is already causing trouble. It creates this constant, low-grade inflammation and something called oxidative stress. You can almost think of it as a kind of cellular rust. This whole process is actively damaging the ovaries and chipping away at the number of healthy eggs you have. And this slide really lays out all those different battlefronts. You've got the physical blockages from cysts and lesions. You've got that inflammation we talked about, creating an internal environment that's just hostile to conception. Then there's that oxidative stress, that cellular rust that directly damages your eggs. And hey, even if an egg and sperm manage to get together, the uterine lining itself might not be receptive to implantation. It's just a relentless, full-court press. So you're dealing with these painful cysts, these endometriomas. The most logical step seems to be surgery to get them out, right? Well, this is exactly where we step onto that tightrope. The goal, of course, is to get rid of the disease and the pain. But every single move a surgeon makes comes with a very, very real risk to your future fertility. It's an incredibly delicate, high-stakes situation. The standard procedure is called an ovarian cystectomy, but the technique itself is literally called stripping. The surgeon carefully separates the wall of the cyst from the healthy ovarian tissue and just pulls it out. Now, what's the problem? Because that cyst is embedded deep in the ovary, it is almost impossible to remove it without also taking some healthy egg-containing tissue right along with it. And the impact of that? Wow, it can be absolutely staggering. One major review found that in the period right after this surgery, the average drop in AMH, that key marker of our ovarian reserve, was 44.4%. Just let that sink in for a moment. That's nearly half of your reproductive bank account potentially gone from one single, often necessary surgery. This isn't some minor side effect. This is a critical, life-altering piece of the puzzle. So this all leads to a really tough choice between two main surgical routes. On one side, you have that cystectomy, the stripping method. It's the preferred method because there's a lower chance the disease will come back. But the price you pay is that huge risk to your ovarian reserve. Then on the other side, there's ablation. That's where the cyst is drained and the lining is essentially vaporized. It's way less damaging to your egg supply, but it might come with a higher risk of the cyst growing back. There's just no easy answer here. It's a classic, difficult medical trade-off. And it gets even more detailed because even within a surgery, the specific tools used matter a lot. After a cyst is out, the surgeon has to stop the bleeding. The old school way is to use heat, called bipolar coagulation, which can actually burn and damage the healthy tissue you want to save. But newer techniques use what are called hemostatic sealants. You can think of them like a medical-grade glue. Now, the research is still ongoing, but some important studies suggest these sealants lead to a much smaller hit to your ovarian reserve. It just goes to show that every single choice made in that operating room really counts. So, you're faced with a disease that hurts your fertility and a treatment that can also hurt your fertility. It sounds pretty bleak, right? But this is where we pivot. This is the empowering part of the story. Proactive fertility preservation.
This is all about taking control of your future before you're backed into a corner.
And the number one tool we have for this is Oocyte cryopreservation, which you probably know better as egg freezing. The idea is so simple, but so incredibly powerful. Retrieve and freeze your eggs now while your ovarian reserve is at its highest point, so you can give yourself the best possible shot at having a biological family later on.
So, how does it actually work? Well, it's basically a four-step deal. First, you take hormone medications for about 2 weeks to encourage a whole group of eggs to mature at the same time. Then there's a quick, minimally invasive procedure to retrieve those mature eggs. The real magic happens next, with a process called vitrification. It flash freezes the eggs so fast that those damaging ice crystals don't even have a chance to form. And finally, they're stored safely in liquid nitrogen until you're ready for them.
And if there is one thing that all the research just screams at us, it's this: timing is absolutely everything. This quote here really nails what study after study has found, that having surgery for these cysts is consistently linked to getting fewer eggs when you try to freeze them. So the consensus is crystal clear. If you're thinking about surgery for endometriosis and you might want biological kids one day, the talk about fertility preservation has to happen before the surgery, not as an afterthought.
And this chart is just so powerful. It really highlights the strategy here. See, because endometriosis can sometimes mean you get fewer eggs in any one cycle, just doing it once might not be enough. But what this shows is that by doing multiple cycles, patients can strategically build up that reproductive bank account over time, basically overcoming that deficit and seriously boosting their chances for the future.
And if you needed one last statistic to really hammer home this idea of preserve before you operate, here it is. One study found that having a prior surgery was linked to a jaw-dropping 51.7% reduction in the number of mature eggs they could retrieve. That's more than half of your potential just gone. It's a number that makes the case for planning ahead absolutely undeniable.
Okay, so where do we go from here? For the last part of this, we're going to look over the horizon, at the incredible technologies being developed, but also at the very real, very human challenges of making sure people can actually use them.
I mean, some of this stuff is straight out of science fiction, but it's becoming a reality. AI could soon give us totally personalized treatment plans. Scientists are working on 3D printing ovarian tissue to restore function. And then there are things like freezing a piece of the ovary itself or maturing eggs in a lab, which could offer incredible new options for people. The future on the tech side is just unbelievably exciting.
But, and this is a huge but, all the amazing technology in the world doesn't mean a thing if people can't get to it. The cost is a massive barrier. We're talking $10,000 to $15,000 for a single cycle, and you often need more than one. Insurance coverage is a total patchwork mess. And on top of all that, there are these deep systemic disparities. We know that ethnic minorities are far less likely to use these services, and whether a patient is even told about their options can come down to their age, their income, or even their zip code. We've got the science, but we don't have the equity. Not yet.
And that brings us to our final and maybe most important question. The science is moving at light speed, offering hope that was just unimaginable a generation ago. But as all these new doors open, we have to ask ourselves a tough question. How do we build a system where these choices aren't a luxury item, but a fundamental right? How do we make sure that every single person has the chance to choose their own future?